25 years ago, most of the people that I saw were basically, they complained about their joints. They had a bullseye. It was kind of the classic definition of what people still think Lyme is. They think, oh, I got bit by a tick, I got a bullseye, I got a rash, my joints hurt, I don't feel very well. And I think as time goes on, what I'm seeing is more in-depth, neural Lymes, anxiety attacks. My concept, what I tell people, is that Lyme leads to all symptoms. All symptoms don't lead to Lyme. So you can have a symptom, doesn't mean you have Lyme disease. But if you have Lyme disease, all symptoms can be put into that category because it leads to that heart disease, nervous system, anxiety, joint pain, fatigue, fever, every kind of problem that you have that has no etiology. You don't know, why do I have this thing? Then you start thinking, I got to look at Lyme disease. I got to think maybe there's Lyme disease. And so that's the gist. Acute, chronic. Of course, I see more chronic because people finally get sick of going to get antibiotics. They get sick of going everywhere else and not getting any help. And so the chronic people wind up at my office. But I also see acute people. And so that's a different treatment than chronic. And now in Western medicine, there is no chronic Lyme disease. It's just called a post-sequela of Lyme disease, which means the Lyme is there, did damage, now it's gone and it goes away. And I do believe there's some truth to that at some stage. So you've got these kind of three phases, which is infectious phase, reduction of inflammation and damage, repair phase, and then the maintenance phase, which is kind of like the second phase in that long-term repair of things. Some things take longer. But it's also maintenance, keeping yourself healthy. According to the CDC, there is no such thing as chronic Lyme disease, so we're looking at the damage that the spirochete does afterwards. So after you've treated the infection. So an acute infection, you're doing 3 weeks of doxy. Doctors have a little, they can go a little bit longer on the doxy. And then after that, it's considered you don't have Lyme disease anymore. Some doctors now will institute mega doses of antibiotics, and they'll go for years, even when there's no results, or even if the results are just barely results. And I think that's a real inappropriate approach to the sequela of Lyme, which is an autoimmune / damage done, repair the damage. We always have Lyme disease. Just like people in Mexico, they can eat the food, we can't eat the food. They're used to it, we're not used to it. We're not really used to Lyme, even though they find Lyme disease thousands and thousands of years ago. They dig these Paleolithic people up and they go, oh look, there's Lyme disease here. Yeah, so Lyme's been with us for a long time, and it's, I think the traction, why is it gaining traction? Why all of a sudden? I would like to think more contemporary. We're poisoning ourselves with all kinds of pesticides, toxins in our food. The bees are taking a hit. We as human beings are taking a hit. And Lyme, in my opinion, is an opportunist infection that also teaches us something. So the opportunity to learn something. If you're poisoning yourself, if you're toxic, you got to clean your act up. If you're stressing yourself out too much, you've got to de-stress yourself. You've got to become healthy. We've got to become healthy. And that's the message for Lyme. So, for instance, when I had Lyme disease, it went through every system in my body. It went through my systems and it the joints. It went through the muscles. It went through my nervous system. It went through my neurotransmitter and my emotional body. It went through all the systems that I needed to look at and make a correction and then to become healthy. And so that's what I did, and that's how I overcame that. And that involves all the levels of treating with antibiotics, not doxycycline, but natural antimicrobials, building the immune system, clearing out inflammation, reducing inflammation, repairing tissue, nourishing, making sure, yoga, exercise, all those things bring you back. And so that is why I believe that Lyme is creating this resurgence, because we are susceptible to it now. Maybe people have been getting it for a long time. Didn't bother them. Didn't know they had it. Maybe they had that classic, oh, chills and fevers, got a cold, it went away. Now it's not going away. And so we really need to heal ourselves in the broader perspective as well.